If you or someone you know is sick, have tried to get help and is not feeling any better, then call or visit the Health and Wellness Center, where we will screen your entire body and find your problem and treat you so that your body will overcome your illness. So visit us today at 72 Queen Street, Kitty, or call us at 231-6477 for further information.
All right, a very good evening to all of you, my friends, well-wishers, family members, those of you across the oceans. Welcome to our program once again. We're having a late start. However, better late than never, and we're on. It's live in the studio. That is why we were late, because we had to get the studio set up, and it's not the same as when you're on long distance, but I'm in the studio, and I'll be happy to take some calls from you this evening. Those of you who had all of those calls piled up, I'm here, and I'm here live in the studio tonight, so you can call and don't stop by because I'll be busy. Welcome to a program once again. Before we get started, I wanna really don't know what to say, but the devastation that occurred across the seas in Florida, really terrible, really sad, really frustrating situation for many of the persons who would have gone through one hurricane, and then a few days later, here comes another one. Many persons are still recovering from previous hurricanes that were struck again by a recent hurricane. So, I mean, it's really devastating to know that you can't really catch yourself, and so many persons are still trying to understand why. Some persons who were here this time yesterday are not here today because they would have lost their lives, and we want to pass on our condolences to those families who would have lost members due to the storm surge, or maybe whatever situation occurred in the hurricane. If it's by the tornado, because it came with tornadoes, and I know what a tornado is like. It's like because I was sharing that my experience that I had in a tornado. I really did have an experience in a tornado. I didn't really know it was a tornado. Of course, I didn't experience one before. That was the first time I experienced one, and I saw these objects flying around, and people on motorcycles just going all over the place in the air. And I'm saying to myself, they must be making a movie somewhere, It looked like a movie was being made. And I saw a car that kind of flew across in front of me some distance away, but not on the road, in the air. So I said, okay, this is not no movie, this is real. So when I pulled into the parking lot and I came out, I tried to come out of the car, the door wouldn't open. I'm pushing and pushing and pushing, and it wouldn't open. But then all of a sudden it opened up. When I came out, I realized this is not normal. This is something real. And I ran into a store in the shopping plaza, and everybody thought I was crazy to be out there. I didn't know what it was. So I'm happy to be here still to talk about it. But experiencing a tornado and a tornado in a hurricane, I mean, I can really not understand the two at the same time. So the persons who are really trying to recover, some are not even home yet to see what has happened to their homes or their properties. It's really sad. Let that not happen in Guyana. If that happened here, my friends, if we experience what occurred in Florida yesterday in Guyana, pray that it doesn't happen, because we will not be able to clean up here for decades. I'm telling you, the way houses are built here and the way people live and the things that happen here, we will not be able to recover for decades. So let us do everything we can to prevent those types of disasters from happening, okay? Dr. Richard would not be on today. We were hoping to have him on, but because I'm live, he's not going to be on today. I want to continue our discussion regarding cancer, since it's Cancer Awareness Month. And in our screenings, we are seeing, it seems like because it's Cancer Awareness Month, we're seeing many persons with cancer, more persons with cancer, and it's happening more and more. For some strange reason, we're having cancer occurring in persons, even babies, children, teenagers. You know, I don't know what is happening, but people are just, they're not sick, and then all of a sudden, 2 days, they're dead. You know, all of a sudden, they're not feeling well, and next thing you know, they're gone. So I don't know if there is some being that is in our presence that's taking the lives of people silently. You know, we have to be really careful and be on the lookout, because it's happening too often. So, and I know that it's not cancer that's doing that. You know, those are maybe cardiac arrests or aneurysms or something that is causing persons to have sudden death. You know, it's not good, because you would leave to go to work, or you leave to go someplace, and next thing you know, someone is getting a call that, you know, you're not going to make it back home. So my friends, I want to tell you, we are in serious times, and you've got to really, really take note of what is happening around you, and try very hard to go into some preventative modes. Seriously, some preventative modes, because we don't know what's going on. I have an idea, but I really can't say it. I don't want to say it, because I don't want anybody coming after me for anything, nor suing me for anything, you know, because I may, you know, talk about what my views are with those things. But I have an idea, and I have some concerns, and I'm really not feeling very good about what I'm thinking. Okay. I just want to say a few things about our program that we had last week, and I want to continue from there, because we talked about factors that may contribute to cancer. We talked about some types of cancers, and tonight I want to continue that, because it's happening very frequently, and we're diagnosing a lot of cancer, and some people are not even aware that they have the cancer. You know, we have the ability to actually test immediately and get your results back immediately, depending on you know, what we feel and what we find and where we look. Because when we screen you, we can actually target areas that we want to examine and focus on those areas, and or we can screen the entire body and then let you know if there's anything existing, any part of the body system. So if you want to know what is going on with your body, don't be afraid to call us and schedule a day to come in, because we can tell you within minutes if there is a condition that exists, if there's a cancer situation, if it's malignant, if it's just started, you know, where it's located, if it's gone somewhere else. We can even tell you what caused it. Okay, I'm not kidding you. All right. We're also finding that there are many persons who would have contracted diseases, and because they're hidden, because these infections are hidden, they're not aware of these infections. They're not aware that they're present, because they're not having the symptoms, but they know that things are happening. They know something is wrong. For instance, we have men who are developing urinary problems, and they're thinking maybe it's some type of urinary infection. They're urinating frequently, and they're thinking maybe it's some type of, you know, some urinary infection or so. When we screen them, we're finding that there is something larger than that, not just a urinary infection, but a prostate problem. The prostate might be enlarged. Then we have to go looking as to why this prostate enlarged. Why did you have this inflammation or this inflamed prostate? So we dig deep and we find serious issues that existed sometimes for years, and that is where we find the root causes of certain things. And I'm just using that as an example. We also find the same thing happening in women. You know, you want to know why your breast cancer, why you have the cancer in your breast, why it's in your pelvic region, why it's in your kidney, you know, why it's in your colon. We can track it, we can trace it, and we can let you know actually where it began. Seriously, we can do that. Not too many people can do that. Some persons are also told of cancer or are diagnosed with cancer, as they say, and what we're finding is that they may have cancer cells, active cancer cells, but active cancer cells doesn't really label you as a cancer person or a cancer patient. You know, yes, the cancer cells may exist, but they're actually looking for a host. We call it a host, or someplace where they can merge to and multiply on that organ, where you know they can actually become living organisms and begin to destroy those organs. You see, so we also find that and it is stated that many times when you see tumors in persons, or you think that they're tumors, because I did ultrasounds and we would see masses, and we would think that that this is a tumor, and it needs to be, you know, further investigated. You have to do maybe some sort of a biopsy to try to see if this is a malignant or benign tumor. And we're finding that many persons are being told that they have these tumors and that they're cancerous without any further investigation to see if it really is cancer. You know, so we really have to be careful with what we do after we're told what's happening with us, because many persons sometimes don't really have cancer. They may have a tumor or they may have tumors, but it doesn't mean that the tumor is cancerous. It could be a benign tumor. Okay, it could be a tumor that is there, that is benign and is non-cancerous, but not because it's a tumor, because it's labeled as cancerous. Unless a biopsy is done, or you can actually verify that this tumor is a malignant tumor, then don't be alarmed. Get opinions. Get a second opinion, sometimes even a third opinion, before you do anything drastic, because, you know, dealing with cancer is a serious thing. Because many persons, when they hear the word cancer, they think, you know, I'm not going to live too much longer, right? It's not always the case. You know, cancer can be overcome. It's something that I know you can overcome it once you are able to find the source of the cancer, and you can actually target that area, or target the areas where the cells might be that are active, and try to fix the cause. You know, one of the problems that we have with persons who have illnesses, not only cancer, but illnesses in general, is that the causes are not really looked at. You treat, for instance, someone has high blood pressure, okay? And you go to the doctor says, yeah, you have pressure, you have high blood pressure. Yes, you do. And you need to be on medication. So you take the medication for this high blood pressure, and you take it for the rest of your life, because you're not dealing with what is causing the pressure. You're not changing or modifying what you do to cause this high blood pressure to occur. So you will continue to take this medication until something else happens with your kidney, and then the next thing you know, you're having to go through all sorts of things, including dialysis, and then kidney failure, and next thing you know, you're gone, right? So you want to deal with the root causes of things. Don't just buy anything and says, okay, all right, well, what are you going to do next? Well, we have to take off your breast, or we have to take out your reproductive organs, because we don't want it to spread anymore. how do you know it's cancer? Are you sure? Have you acknowledged that this is really cancer? Many persons are going down roads or routes that are dangerous without really understanding, if this is really cancer. Is it really cancer? And if it is, don't be afraid to ask. I think one of the things that happened to many persons is that they were afraid to question the doctor. When they come by our clinic, they want to ask us everything all day. If you leave them alone, they'll ask you questions all day. But when they go to the institutions, they're like mouses. Their mouth's gone to sleep. Ask the doctor. Ask the oncologist. I don't care who it is. Ask them, doctor, are you sure this is cancer? How do we know? How do I know for sure that this is cancer? Let them tell you. Can you tell me what caused this cancer? Do you know where it started? Because for instance, you may be told that there's cancer in your left breast. Okay, your mammary gland on the left side, there's cancer. Right? So what are we going to do, doctor? We're going to take out the breast. We're going to take out the glands. They take out the breast, take out the glands. A few months later, you haven't really fully recovered yet. You're feeling something else on the other breast. When you go back there, you're told, you know what? The cancer has spread to the other breast. Now we have to take off the other one. So you go through the same thing again. You haven't recovered yet fully from the first. You take off the other breast. So you now have double mastectomy. You take off both breasts, and you're going through now like a spinning wheel. A few months later, maybe not even a year, sometimes a year, just over a year maybe, the cancer is back. You're getting pains or problems in your uterus or your ovary or somewhere. And the next thing you know, you go back, oh boy, the cancer is now at your ovary or your uterus. Or we have to take out your ovary or your uterus. It never ends. It never ends, my friends. Until you find the root causes of things, don't go through any surgery. I don't care what anybody tells you. Try to make sure that whatever is told to you is really what is happening with you. Get all the evidence you can before you touch anything. And if it's possible, try and ensure that you know the root cause. Where did it come from? Where did this begin? And deal with that. Deal with that. Every journey that you go on begins with one step. One step. Just try to take the right step. There's always a cause for something. There's nothing that happens without a cause. If your head hurts, it doesn't mean that it's the head that's the problem. It could be something else that's causing the head to hurt. Normally it is. Find out what caused the head to hurt. Find out. So don't just take one word for granted. Get many words. Find out. Get your opinions. Get other persons that are credible to actually say to you that this is really what is happening to you because of this or that. I want to advise you, my friends, that you can tell your friends that they can go to our YouTube channel and they can see us live. You really can. Go to healthandwellnesscentergy.com. Just go to YouTube, putting my name in there, and it'll come up. www.healthandwellnesscentergy.com. Put it in. Just Google it. www.healthandwellnesscentergy.com. Straight. And you're going to be taken right to our right live to this program right now. Just do it. It's on the screen there. Just put it in, and you'll be taken right to the live. You'll see me live right now. So as I was saying, it is ultimately important that you get all the facts, put all your ducks in a row. Make sure you dot all the I's and cross all the T's before you do anything drastic. Many cancers can be overcome. Your body can overcome many cancers now if you find the causes, if you start early and if you make some adjustments. Okay, I was told to remind you that you can go to YouTube, www, no, http://www.youtube.com, and or you could put in my name, Dr. Joseph Haynes, on YouTube, and you'll be taken to the site. You can tell your friends about that too, right? But I want to caution you with your diagnosis is that it is so important for you to examine all the factors, because you're going to be taking some drastic steps now that you've been told that you have cancer. You want to make sure that, number one, that it doesn't scare you. Okay, I've had someone yesterday who was told that he has stage 4 cancer, and this man was all messed up. You know, he was all messed up. He was all shaken. You know, was really shaken. So I asked the question: Did you said that they say you have stage 4 cancer? He said yes. I said, did they do a biopsy? Was there any investigation done? No. Nothing was done. So how did they know it was stage 4? Well, there's a tumor that I have, and they said it's stage 4 cancer in my kidney. Okay. Well, so far we haven't seen that. There is a tumor. There are cancer cells, but far from the stage 4. You know? So, I am not saying that the doctors sometimes are not correct about diagnoses, but before you allow yourself to become, I don't want to say guinea pig, to become a person in a situation that will take you out of the world, because it happens most of the time at stage 4, I would suggest that you seek maybe 3 opinions, just to make sure that that is so indeed. Because the decision that you make could be the decision that either save you for an extended period, or will cause you to go out of this world very quickly. And it's happening every day. Many persons are leaving. Many persons are leaving. And they're not coming back. You know, some people leave, they travel out of Guyana, and when they come back, they're brought back in packages. Sometimes we call them coffins, you know, or boxes. You don't want to be one that is placed in a box. And sometimes when we think that there's betterment in some other institution someplace else, sometimes it's not. You know, I always say that, and I believe that, and I've proven it over and over, that if someone tells you that you have stage 4 cancer, try to find alternatives. Try to find alternatives to helping your body to either live with it for an extended period of time, or to have your body overcome it. Because you can overcome it. I can tell you that. I'm speaking to you from experience. You can overcome it. You know, cancer is not a death sentence. It's not. As a matter of fact, not very long ago, AIDS used to be a death sentence. When someone said that, oh, you have HIV, you know, people used to think that, oh, I'm done. I'm done now. HIV, oh boy, I'm done. No. HIV is not a death sentence. Not anymore. There are many persons living in the world who had or have HIV and are still living normal lives. Okay? That's a virus. So is this one. It's a virus. You've got to get your body to a point where it's able to neutralize the effects of that condition, and then work with the body so that it can slowly overcome what caused you to get that condition. It's not a process that will take a few minutes or a few days, because to reverse it, it takes a lot of time, a lot of commitment. And the biggest problem that we have with persons, the biggest problem we have, and the biggest problem that you're going to have, is making that adjustment so that your body can neutralize and begin to overcome that condition that exists that wants to take you out of this world. Many of you don't want to make changes. You will never be able to overcome any condition, I don't care what it is, if you keep doing the same thing that got you there. Listen to what I'm saying to you. If you keep doing the same thing that got you sick, if you eat the same foods that got you sick, if you eat the same foods that got you to become a diabetic or a hypertensive person, you can never overcome it. Your body will never overcome those conditions until you change what you've done to get where you are. I'm very serious, and you need to understand that. You can't want to keep hitting your head on the wall and expect that it's going to stop hurting your head. You can't keep using MSG or Agi and expect that your pressure is not going to go up, and expect that you're not going to encourage cancer cell or cancer growth. You can't be using Agi or MSG and expect that you can overcome the things that are causing you to have high blood pressure or maybe even cancer. It is known that it causes cancer. There are many factors that contribute to cancer cells being active, And some of you you tell yourself you can't eat food without certain things. You can't live without eating certain type of foods. And again, I'm going to repeat the phrase that I always mention. We dig our graves with our teeth, and we eat ourselves into our graves. Listen to what I'm saying. We dig our graves with our teeth, and we eat ourselves into our graves. In other words, the foods that we eat many times contributes to the demise that we experience. Only today, only this afternoon, I was listening to I want to say an article that talked about diabetes and what contributes to it that people don't even realize. You think it's sugar? You think it's sweet? It's called sugar. We call it sugar. But diabetes has its roots in fats. In fats, in all them French fries that we eat in all the fried chicken, the fried fish, the fried foods, the samosa. Everything that we fry contributes. The fat contributes to our demise. Diabetes is proven to come from fats. And we see it every day in people. Everything we have to fry. Everything we fry. And we don't exercise. And we don't cleanse. We don't detoxify our bodies. We don't deworm our bodies. Worms, parasites, worms, has serious roots in cancer. It's one of the biggest, most contributory factors to cancer. Worms. We have proven at our facility that, not only here in the US, that many times when you think it's a tumor that is somewhere in your colon or in your stomach or in some part of your body, many times when you think it's a tumor, guess what? It's a nest of worms sitting there looking like a mass. There are worms in your body right now, many of you, that lays over 200,000 eggs per a day. Worms in your body. 200,000 eggs per a day, every day. They're in there and they're laying eggs every day. Can you imagine if a chicken, just imagine a chicken, right? laying 200,000 eggs per day. Where are you going to put them eggs? If you have 10 chickens, 10 chickens laying per day, 200,000 eggs in a chicken pen. Where are you going to put those eggs? Well, just imagine worms in your body. And these worms are not just single worms, not just one. These worms multiply. Can you imagine if you have in your body 10 worms that are multiplying 200,000 eggs per a day for a year? What would that look like in you? And these worms, they eat, they mess, and they multiply, all inside of your bodies. I'm not telling you what I think. I'm telling you what I know. And the evidence is there. Stop looking at your phones and your tablets at nonsense on a daily basis. Stop texting and going over garbage on a daily basis and start looking at things that can benefit you. You don't believe me? Do some research. Look it up. Spend some time learning what can happen to you if you care about your body and your health system. We have so many worms in us, some of us, so many worms. We've seen as much as 12 different worms in one human being at one time. I'm not kidding you. So, you want to know where those lumps are coming from, where those tumors are coming from? You want to know where your polyps in your intestine is coming from? You want to know where they're coming from in your uterus and your breasts? You want to know? Think about what you're eating and drinking. Just think about it on a daily basis. And think about how long you've been doing it, how long you've been using the algae. Huh? Think of how long you've been using those things that are full of chemicals. And every day we see people with lots of lead and mercury. Where is all this lead and mercury coming from in humans? And you talk about the vegetables that are being grown and sold out there. If you know the chemicals that are in those things. But we have to eat. That's the reason why I'm saying to you, grow your own. Grow your own because you know what is in it. Feed a garden instead of feeding a dog. Take the money that you take to buy dog food and there's puppies and all that, and plant gardens. Spend money doing things that can benefit you. Clean up your yards. If you have concrete, get some tires or some pots and plant. Plant your callaloo, your pak choy, your okra, your karila, your cabbage, your bolanje. Plant. Plant in your yard. If you don't have a yard, plant in your house. They will grow. They will grow. Because when you eat, when you buy those things out there, I don't know what you get. I don't know. Sometimes I can smell the chemicals in those things. And I know you do too. And you can't wash them out. You know, I hear people say, oh, wash them out with bleach and wash them out with vinegar and soak them overnight and everything. You know, you hear all the things. You think you can get those chemicals out of there? They're grown in there. I've heard farmers say that they wouldn't buy their own cabbage. What they sell? No, I don't eat that. I grow my own that I eat. Seriously. So please, my friends, please, please, stop digging your grave with your teeth and eating yourself into your graves. You want to know why we have so much cancer? It's not just because of worms. It's because of chemicals. It's because of smoke. We eat so much smoked barbecue, it's crazy. It's ridiculous. We eat so much of the dead. So much of the dead. Stop eating the dead. What can you benefit from the dead? Nothing else but you have to bury it. Eat living organisms. Eat things that can give you life, that can give you nutrients, that can, I don't know. I mean, people might think that something's wrong with me, but I don't know. I think that we need to start thinking again about what we eat. Seriously. I have to mention to you that we still have Dr. Tatiana who works along with us. Remember, some of you remember Dr. Tatiana. She's over in Ukraine and she works with us remotely. We have Dr. Richard who works also at the clinic remotely, and then I'm in and out. So it's 3 of us that are there, and we're pretty busy, I'm telling you. But we'll be glad to make a difference in your life. We'll be happy to help you to understand, what you need to do to bring your life back to a point where you can enjoy it. Because many of you cannot enjoy your lives. You're so sick, some of you can't even get out of bed. Some of you are so sick you can't even walk. So much pain you can't even turn. How can you enjoy life with pain and you can't move? How could you? It's time that you take charge of your life. It's time for you to do an inventory or do an audit to see if what you're eating really is benefiting your body. Let your foods be like medicines to your body. In other words, when you eat something that can benefit you, that can give you some nutrients, that can help your body to be invigorated, so that you can have the ability to overcome. If your immune system is weak, how can you fight? How could you? The only thing you have to work for you is your immune system. I'm telling you. And if your immune system is weakened, you're in serious trouble. You have to keep your immune system up all the time, because there are people out there with viruses. There are all sorts of viruses in the air. There are people who are coughing and don't know why they're coughing. They're sneezing, don't know what comes out of their mouth when they sneeze. There are people who are walking around they're like transmitters. They're transmitting viruses into you and you don't realize it. They themselves don't even know they have them. That's why I'm saying to you persons, you think the mask is only for coronavirus? Wearing the mask is not just for coronavirus. There are lots of diseases out there that a mask can at least cushion some of the effects of them. And when you build your immune system, my friends, then you have another weapon in your arsenal that can help to defeat some of those viruses. And cancer is also a virus. It's also a virus. It's oncology virus. If you don't have an immune system that can work for you, you're going to be defeated. So please, Patrick, I know you're watching. Okay, you and your wife, I know you're watching all the way in Turks and Caicos. I know Oliver is watching. I know there are many persons in the Caribbean who are looking at us. Okay, listen. The most important thing that you can do to help your body to fight anything, including cancer, is to find what it takes to enhance and build your immune system. Okay? Even when you're working towards overcoming, you cannot overcome unless your immune system is working for you. That is the mechanism that will help you to fight. You take away your defense mechanism and you're gone. You're weakened. Many of you are trying to overcome diseases and your immune system is not working. You're not taking care of that. Marcia, you have to take care of your immune system. Patrick, you need to build it. Joy, you need to keep building your immune system. Esther, same thing. All of you need to build your immune system, wherever you are, on a daily basis. Build your immune system. Annie, same thing. All of you, build your immune system. If there's nothing else that you do on a daily basis, enhance your immune system. Why? Because when you go out there in the world, wherever you go, you don't know what you're going to have to face. You're traveling in public transportation. You don't know who is sitting next to you and what they have. When they talk, you don't know what comes out of their mouth. You don't know what's in their belly. Some of you, when you pass gas, you yourself can't stand it. You wonder if something died in there. I'm serious. If you cannot stand what comes out of you in that form, my friends, imagine what's happening in there. Imagine what's going on inside. You've got to detoxify your system. You've got to cleanse. Some of you, your perspiration smells so bad, you yourself can't stand it. And when you walk around, you're wondering if other people are smelling it. Of course they are. What is coming out of you, my friends? It's inside of you. If it's not in there, it's not going to come out. Those are signals that are coming out to you that you need to pay attention to. Take note and take action. Take action because it's something that's happening inside that you're not aware of. I'm telling you. When you go into the toilet and you come out, anybody should be able to go in after you. Yes. If they can't go in after you, my friends, and they got to use Lysol and perfume, whatever else is there, there's something wrong. Something wrong inside of you that needs to be dealt with. Your colons need to be flushed. Your diets need to be changed. Stop eating the dead. Stop eating the dead, my friends. You need to fast. Some of you need to fast. You need to cleanse. You need to deworm. You want to get rid of cancer? You cannot get rid of cancer unless you clean the environment that the cancer came from. You wouldn't. And some of you are going down the wrong road believing that certain approaches are going to take care of it. You better think again. You better think again. You know, I was asked to remind you, somebody says I'm sounding angry. I'm not really angry. I am just expounding. Because this is something we do every year. Every year we talk. This is something that I've been doing since 1996. I've been on the air since 96, you know. And I've been talking about this for year in and year out. And some of you are not getting it. You're not getting it. Let your foods be your medicines and your medicines be your food. Eat foods that are going to nourish your body. Eat foods that are going to nutrify your body. Detoxify, remove, just like you clean your houses. Some of you every year, you strip your house and you clean it down. You wipe the walls, you paint the walls, you clean the floor, you change the carpet, you wash it, you shampoo this, you do all that. Do the same thing with your body. Do the same thing with your body, a little more frequently. Clean what's inside of you. Cleanse your system. Detoxify. Deworm. Change your diet. Start eating foods that are healthy. Plant your own gardens. Stop drinking all the sodas and all the acid-forming foods that you eat and all the drinks that are colored and distorted and have no nutrients inside. Some of you drink beverages that are poisonous to your body. They're like poison to you. And then you expect this body inside, these organs, to process that and give you good health. It doesn't work like that. It doesn't work like that. So I'm saying to you, this is Cancer Awareness Month, they say. Cancer awareness, in my opinion, should be every single day, not just the month. Cancer awareness is something that should be in your state of mind consciously every day. High blood pressure, you think about what I'm doing to cause that every day. Diabetes, every day. Cut the frying, my friends. I'm telling you, you want to know where your diabetes and your pressure is coming from? Cut the frying. Start using things that are steamed, broiled, and baked, and stop using all those oils. Because many of you don't exercise, you don't burn anything. You're eating everything, but you're not. Some of you, you know what's funny? There are persons who don't go to the toilet to defecate, to have bowel movement, sometimes for a week or two. I'm serious. And I know many of you who are hearing me are like that. You don't defecate for a week or 2 weeks. Can you imagine what's happening inside there? You're eating every day and you're not going to the toilet to remove what is waste? If you understand the cycles that the body goes through every 8 hours, you would realize that you need to defecate every single day. If not twice, at least once. You wonder why when you pass gas it smells the way it does? Think about how often you go to the toilet. Think about all the dead matter that you're using to eat for lunch and dinner. Sometimes for breakfast. We are digging our graves with our teeth and we're eating ourselves into our graves. You wonder why so many young teenagers are passing out suddenly with heart attack? You wonder why? Think of all the Red Bull and all the XL and all the Red Bull and XL with Guinness. What's wrong with you people? What are you trying to do? You think it's going to make a difference in your life positively? You know how many persons would have died already doing that? All that caffeine in your system at once? And some of you don't really eat foods. You don't eat healthy foods. You're actually building your coffin on a daily basis when you do that. I'm not saying that, if you live long enough, you're not going to die. Of course, one thing we can't escape is death. What I'm drinking is a healthy drink. One thing we cannot escape is death. But the thing is, you want to live a long, healthy life until that time comes when your maker says to you, it's time. You're now gone over 100. You're now 103 or 102. How much longer you want to go on? There's some people who are living healthy lives at 90 and 100, So you can live long. You can live long, healthy lives. You can live cancer-free. You can overcome cancer. You can overcome diabetes and hypertension. It begins in your grocery cart. No, it begins in your head. And some of you, if you don't believe you can get better, you're not going to get better. If you don't believe that the approach that you're taking is going to help you to overcome what is wrong with you, it's not going to happen. Because healing first begins in the mind. And you've got to program that mind. So I want to say to you, I know we're running out of time. Number one, eat healthy. Eat foods that are going to nourish your body. Eat foods that are going to nutrify you. Eat foods that are going to give you the nutrients that you need to exist in this world. Number two, grow your own foods. Grow your own food. It's not a problem if you go once in a while and you may have something you eat differently, just for maybe a little bit of entertainment or rewarding yourself, or maybe you just want to go out a little bit and enjoy something else that's healthy but in another form. Nothing is wrong with that. But on a normal, regular basis, eat healthy foods. Grow your own garden. Plant your own crops in your yard. Even in tires, you can do that. Number 3, don't wait until you're nearly dead before you come to the clinic. There's 3 of us that are working. We'll find a way to get you there. We'll find a way to get to you. Number 4, if you're going to call the clinic, don't just call and leave your name. And many of you do that. Leave a number so we can call you back. Because at some point you're going to call back, and when the phone is answered, you can say, long I trying to get to y'all and I can't get nobody. I leave my name so many times, but nobody called me back. How are we going to call you if you don't know what number you're calling from? Leave a phone number so we can get back to you. You know how many persons we have with their names and we don't have any numbers? When you call and you leave a message, leave a number. We'll get back to you with a number. The next thing, start an exercise routine. Do something. Don't just be home in the couch like a couch potato all day, or you go to work and you come home and you're watching television and you're not doing anything else, you go to sleep, you're eating. Start an exercise routine. Go walking. Go riding. Get a stationary bike if you can't go and ride in the house. I don't encourage treadmills because they become furniture after a while. But do something that can get your heart at least half an hour, 45 minutes or so, to beat at a little higher, faster rate so you can burn. Get your checkups. Make the appointment. Get your body looked at. Understand what is happening with it. So you will know that at this point I need to begin to do something because I'm not cleansing, I'm not eating healthy, and I'm feeling sick. Don't wait until you're nearly dead before you come. We've actually had people who do that, I don't like to turn you away. But don't come when you're nearly dead, because then I can't really do much for you. Sometimes I can't do nothing for you. So much I want to tell you. So much I want to tell you. But you know what? I just realized that we're almost out of time. Almost out of time. Drink water. Drink water. It's hot. And listen, don't complain about the heat. Because in some places, when you go there, you're going to freeze. Just make yourself comfortable. You cannot change. This is something I wanted to mention. Many of you complain. You complain about things that you can't make a difference with. You can't change it. Can you make a difference with the sun? Can you change what is happening with the sun? Can you change the heat that's coming down from the sun? Can you? You can't. So why are you worrying about it? Why are you complaining about the place being hot? Find a way to cool yourself down. Drink more water. Make lemonade. Make it and sell it if you have to. Make it and drink it, not limeade, lemonade. It's good for you. Many of you with high blood pressure need lemonade. It will help to bring your pressure down. It will help your blood to flow better. It will create better circulation. It will bring your body into an alkaline state. Use lemon and water. It will cool you. Make cucumber juice. Grow it. And then juice it or blend it. Put some lemon inside and drink it. Put water inside. Put a little cane juice and make a nice beverage and drink. It's going to cool you and it's wholesome and healthy. I just give you a formula. You probably didn't realize it. It's called lemon, cucumber, cane juice, and water. Beverage that will make you probably want to drink it every day. You should. Get yourself looked at. Stop eating the dead. Stop consuming the dead. It can't do nothing for you but kill you. Stress your organs out. mess up your digestive system. Stop frying everything. What's wrong with steaming, broiling, and baking? What's wrong with boiling? Make more soups and drink healthy soups. It will help your digestive system. Stop eating all the flour. Flour sometimes becomes cement in your colon. Go to the national park. Go on the seawall. Or find a place in your area where you can walk at least half an hour, 2 or 3 days a week. Some of you are going to some sizes. I don't know where you're going. I don't really know where you're going. When you get big, my friends, when you put on all this weight, my friends, your body and your organs are designed to work with a certain weight, a certain size. You know how you're stressing your organs out when you get bigger and bigger and bigger? You know how much you're stressing your organs out? You know how much stress you put on your pocket? Because as you get bigger, you have to wear bigger clothes. Doctor, we just say leave Ram goat alone. Leave Ram goat alone. Listen, I really care about your health. Okay? I genuinely care about looking to see you live longer, healthy lives. And you can. You really can. But I can't make you do it. I can only advise you. I can only educate you. I can only, put words out there that hopefully you will hear, you will listen and you'll hear, and you'll adopt. But some of you are so stubborn, it doesn't make sense. It's not making sense to you because you want to be how you are, but then you want to be healthy. You're not going to get healthy, or you're not going to be healthy keep doing the same things that are getting you sick. It don't work, my friends. You've got to change course. You've got to change course. Every day you're hearing somebody you know that dead. Oh, this person just dead. That person just dead. Oh, you think it's and they're younger and younger. It's happening younger and younger. Today, for some reason, people are just falling dead. I have an idea, like I said. But you can change that. Detoxify yourself. You want to know how? Just give us a call. The number's on the screen. Deworm yourself. I suggest that every 2 weeks on a weekend, just like you clean your house and you wash your sheets and your pillowcases, if you do it, I hope you do. And you wash your towel, I hope you do that too. Every 2 weeks, at least on a weekend, at least, detoxify and deworm. You will be amazed as to what will happen to your body if you keep doing that every 2 weeks. Remove the waste matter that's unwanted. Remove the parasites that are there as much as you can. Because remember, they're eating, they're messing, and they're multiplying all the time. I don't know if you've ever seen it, I want to know where you saw it. If you ever see a worm, if you've ever seen a worm exiting a body, defecating outside, and going back in to continue living, I want to know where you see that and what kind of worm it is. They don't come out. Not as far as I know, the worms don't come out. They eat, they mess, and they multiply right inside of you every single day. There's some worms, or the worms defecate more often than you do, except that they do it in your belly, in your body, in your organs. So you get not only worms, you get bacteria, you get fungus, you get infections, all happening in there. Some of you walk around with coronavirus, with bronchitis, with pneumonia, you don't even know. Some of you have coughs for long and you don't know why you're coughing. Some of you can't sleep. You don't know why you're not sleeping. And listen, I'll leave a little bit of advice with you. Worrying doesn't fix anything. Worrying fixes nothing. It's only going to stress you more and cause you more heartaches. Find a solution for what's causing you to worry. Don't worry. It doesn't help. Just find a solution that causes the worry. If you are sick, find a place that can help you to find out why you're sick. You don't believe in us? Find somebody who can. And if it's really, really sick, where you say you got this or that cancer, whatever, get 3 opinions. Don't just buy it. And pray about it and do something about it. Don't just pray about it. Do something about it. Some of you are depending on prayer to fix everything. Prayer can change things. It's not going to fix things. You'll be guided, hopefully, to some place or to some person who can help you to maybe contribute some way, in some form, that can help you to overcome why you're sick. Sometimes it's you who are making yourself sick. Some of you are living in homes that are full of mold and mildew. Do something, help yourself. Okay? I was told it is time. I didn't even realize it. Anyway, I appreciate you looking, all of your input. I've got a lot of input. I want to thank you for participating. We're going to take some calls the next time. I'll try to get back here next Thursday. And we'll continue, and I hope I probably will have a couple of guests with me. So tune in, tell your friends. You know, go online, go to the site. All right? Find where we are and get yourself looked at. And don't worry, don't let cancer scare you. You can overcome it. Until next time, Dr. Haynes saying good night. God bless you. So long.
If you or someone you know is sick, have tried to get help and is not feeling any better, then call or visit the Health and Wellness Center, where we will screen your entire body and find your problem and treat you so that your body will overcome your illness. So visit us today at 72 Queen Street, Kitty, or call us at 231-6477 for further information.